Hello and welcome to the program. Thank you for joining us here. I'm your host here on Health Professional Radio. Our guest today is Dr. Jonathan Sorof. He's a Senior Vice President, Medical and Regulatory Affairs at GBT, Global Blood Therapeutics. Going to have a brief conversation today about some of the disparities in care that people living with sickle cell disease, or SCD, have to live with, and what can be done to kind of help change that situation. Welcome to the program, Dr. Sorof, and thank you for taking the time today.
My pleasure. Thanks for having me.
Well, a bit of background about yourself. I did mention that you are Senior Vice President there at GBT. What's your role there other than Senior Vice President, and a little bit about your medical background?
Well, I was trained as a pediatrician in my earlier career. I spent about 10 years taking care of children, particularly with severe kidney diseases. And then after about 10 years in practice, I joined a pharmaceutical company, and since then have worked in several companies working on areas of high unmet need and often in rare diseases. And I joined Global Blood Therapeutics about a year and a half ago, in part to help lead the strategy for getting our drug approved, voxelotor, for sickle cell disease, and also to see if we can work with the healthcare community to determine how we can optimize care for these patients who really do have significant unmet need in terms of not only the treatments available, but just basic access to healthcare.
What was it that got you into dealing with this specific unmet need as far as SCD is concerned?
Well, when I was in my pediatric training, I actually trained in Washington, D.C. at the Children's Hospital there. And back then, there was not many treatment options for sickle cell disease, and that really remains true today. But I recall very vividly the challenges of taking care of these children and adolescents, and it really stuck with me through my career. And when I was looking to look at my next opportunity to make a difference in developing medicines for patients, I became aware of what Global Blood Therapeutics was doing, spoke with several of the people there, including the CEO, Dr. Ted Love, and he really explained to me the exciting science of what we were doing at GBT, and also the unmet need and the opportunity to make a difference for patients in the U.S., not only, but around the world. And so the combination of the exciting science and the opportunity to really make a difference in an area where there had really been very few advances in treatment options for decades was really compelling to me and got me excited about joining the company about a year and a half ago.
Now, before we get into this exciting science, let's talk a little bit to our listeners who may not be familiar with sickle cell. What is sickle cell? Who's affected? And why is there an unmet need as far as this disease is concerned? I mean, there are about 100,000 or so, a little bit maybe more or less, give or take, who are affected with SCD.
Yeah, so sickle cell disease is a genetic disorder. It's an inherited disorder. It's one of the first ones that was ever actually described, where a single gene mutation leads to an abnormal hemoglobin molecule, so-called sickle hemoglobin. And that hemoglobin molecule behaves abnormally, and it has a tendency to bind to other hemoglobin molecules and form rigid rods that distort red blood cells, and ultimately causes them to be damaged to form a sickle shape, which is why it's called sickle cell disease, and then eventually causes severe anemia and the cells to break open. And the disease is really characterized by many different complications. One of the most important ones, of course, is that it really has a major impact on life expectancy. And patients with sickle cell disease, on average, live about 20 to 30 years less than those that do not have sickle cell disease. But along the way, starting in childhood, they suffer from a variety of complications, most notably chronic pain, acute pain crises. And over time, virtually every organ in the body is affected, because red blood cells are really the cells that carry oxygen to all the organs and all the tissues in the body. And so when they don't function normally, it affects everything from the brain through to the lungs, the heart, the kidneys, and so on. So it's a very serious condition with lifelong complications, and it's why it's such an important issue to address, because these are patients with very few treatment options and not many advances in the last several decades.
Well, with something that is so severe, affecting every organ in the body, what are some of the factors that make it challenging for these patients to access quality care? Because quality care does exist, and GBT is working to make it even more accessible.
Well, there's a variety of issues that contribute to the fact that sickle cell disease patients overall don't get the quality of care that they could access with all the right circumstances in place. In the pediatric age group, overall, the care is better because there are specialists, pediatric hematology, oncology doctors who are trained in taking care of patients with this condition because they're known from birth. In the U.S., there's universal screening, so virtually all patients with sickle cell disease are diagnosed almost from birth. And so they're plugged into quality health care in most cases, and the pediatric hospitals or clinics that have expertise often have many support services in place, and they can really provide the best care available, although the treatment options still remain limited. But they do have access to the support system, a medical home, if you will, that really helps them to be as well cared for as they can be, given the limitations on what's available. The major challenge becomes when children cross over into their adult years and they leave the pediatric setting. And there the challenges are quite substantial because many adult hematologists are not necessarily trained in sickle cell disease, or many patients live quite a distance from a clinic or hospital where that expertise actually can be found. Mm-hmm. And so many patients don't really have a medical home. They don't have a qualified doctor who has an interest and an expertise in treating sickle cell disease. And for that reason, many of them don't see hematologists, don't get access to basic standard of care. And unfortunately, many patients, because of their chronic pain associated with this condition, end up spending a lot of time in emergency departments and seek chronic care in an emergency setting, which is really not optimal for a variety of reasons.
Well, your organization has created the SCD Access to Care Summit. What's the goal of that meeting that was organized by GBT?
Yeah, the meeting that you're referring to occurred back in September, and the Access to Care Summit really arose from a series of conversations I had been having almost since I joined GBT, speaking with physicians who had really committed their lives both professionally and scientifically to determining how best to care for these patients, particularly in the adult setting. And when I spoke with them in various settings, they would describe to me some innovations that they had managed to create with support from hospital administrators and payers and other situations where they had created in their own specific environment a better way for patients to get access to care, building out capability and capacity in a situation where it had not previously existed. And after I had a series of these discussions, I began to ask them, had they ever had the opportunity to share these learnings with their colleagues, because there were some really great experiences and learnings that could be transferred in the right situation. And in almost every case, the academic professionals that I spoke with told me there was really no forum for that type of knowledge exchange, that there was not a meeting that was really focused on this exclusively. And so in collaboration with a really top-tier steering committee of the very people that I was speaking with, we decided to create a forum for a one-day meeting where people by invitation, with intent to select people from all different parts of the stakeholder community for sickle cell disease, would come together and discuss and share best practices and experiences. And then we held workshops that ultimately were intending to create roadmaps for how one could try to recreate some of these innovations that had been described by some of these individual people on the steering committee.
Well, our listeners would like to, and myself would like to go and get some more information about GBT, about this summit, and about sickle cell and some of the access to care issues that we're discussing. Where can we go online and get some more information about GBT and what you do there?
Well, GBT has a YouTube site that has a lot of information including videos, some of which are actually videos that were recorded at the Access to Care Summit itself, as well as some interviews with various people at the meeting, including our steering committee, where they spoke about their personal experience and how they created this solution for access to care. as well as some notes from the meeting itself. So that would be a good place to go for that type of information.
Well, I appreciate you joining us today on the program here, Dr. Sorof, hoping that we can talk again.
That would be my pleasure. We feel very passionately about this topic, and while we are very committed to developing new treatments for sickle cell disease, we also believe that if quality care is not available to patients, if they don't have access to the care, all the best treatments won't make any difference. And so we think this is really a partnership between industry, payers, and healthcare professionals and patient advocates, because no one group can solve this challenge, but we're very much committed to the partnership to see if we can make a difference.
Well said, well said. Thank you for joining us. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au. We've been in conversation with Dr. Jonathan Sorof, Senior Vice President, Medical and Regulatory Affairs at GBT Global Blood Therapeutics.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.